Why did I have surgical weight loss done is because my next door neighbor had had it done at an earlier time, was very successful with it, and I had lost probably 1,000 pounds over a 10-year period, up and down 100 pounds, up and down 100 pounds. So her suggestion was, it's a tool, it's only a tool, and that I'd probably be very successful with it. So she gave me a little tough love. I'm Paul Ford, and I live in Ayer, Massachusetts. Before the gastro bypass, I was at 400 pounds, and now I weigh 192. I had high hypertension, I had high cholesterol, I had water retention to a point where my ankles would swell. I have special socks. My blood pressure off the scale.
If you're not heavy and you haven't been heavy for a period of time, it's hard to know what it's like. They can't sit in a normal seat at Fenway, they can't go to a movie theater, they have to ask for an extra seatbelt on an airplane. It takes a lot of courage to come in and say, I really need help with this problem.
So I went to the Emerson seminar, which was very positive. The data given was outstanding. After the Emerson seminar is when I met Dr. Lautz. It was an hour and a half after, and he made time for us. And he stayed and answered all of our questions distinctly. It was outstanding.
So when a patient comes in for their first clinic visit, they would either see me or one of my other surgical colleagues in their first visit, so they'd know who is going to operate on them and if they decide to go forward with surgery and who's going to help them through the process. And we would go through their medical problems, their medical history, their weight loss history, and spend most of the time in clinic going over what procedure are they interested in and the relative risks and benefits of that, and helping them to decide, one, is surgery right for them? 2, how would surgery fit into their life? And 3, what kind of surgery are they talking about having?
So Dr. Lautz explained where my stomach was going to go, what the incisions were going to be, and with that being said, that was extremely instrumental for me to say yes, I knew what I was up against. So there wasn't any gray area to what was going to be done.
In terms of surgery, we base it generally on body mass index, but roughly it's patients that are about 100 pounds or more overweight. Generally, you want to have somebody that's able to be compliant with what we need them to do before and after surgery so that we can get them through the surgery safely and so they adapt to the surgery in a reasonable fashion.
My wife and I had gastro bypass together because we thought there'd be a good team in terms of learning what we had to eat together, would be reinforcing each other and helping each other. I was in the hospital 3 days. And then home, I was back in work in 3 weeks. The pain levels much better than I expected. I thought they were gonna be a lot worse, which was gonna hinder my getting back to work sooner or later, but it wasn't. Since then, I've lost the apnea. I don't take medication for blood pressure. I can eat stuff I couldn't before because of acid reflux. He said as a positive, I might lose that. And I did. I'm not deprived. I actually can eat what I want to eat, but by definition, I don't eat as much. Instead of a half a pepperoni pizza, I have one slice and I'm done. Now I can walk. Before I used to take the elevator at work. Now I can walk stairs. Imagine that.
We've tried to create an environment where the patients feel supported front to back from the time they enter our clinic for the first time until they're 10 years out or more after surgery.
My experience with the Emerson weight loss team, unbelievably professional, great bedside manner, always keeps it fresh. You're almost like your best friends. Having the weight loss surgery at the Emerson Hospital and the proximity to Ayer being close was a benefit for my wife, travel time, and my friends actually coming to see me as well when I was in the hospital.
For many patients who are at home, who have been struggling with this for usually most of their lives, it takes a lot of courage to pick up the phone and make a phone call to say, I need help.
Now that I've had it done and the success that I've had, should have had it done 20 years ago. Health benefits, losing all the medication, being able to actually play sports with my son, unbelievable.